Hello. If you are a virtual student or you may be watching this today, I'm going to make it available. You may be looking outside at the snow and the ice, which is what I'm doing. I'm going to try to make this a little bit bigger. There we go. All right. So our next section, and I know you guys didn't get to take the test on integumentary disorders and diseases, but we will get to that. I'll post once we're able to come back to school. But we're going to be looking at diseases and disorders of the skeletal and muscular systems this week. Lots of pictures, not lots of notes again. So the first thing we're going to look at is fractures. Then we'll look at a few more skeletal diseases and disorders, and then at muscular diseases and disorders. All right, so there are lots of different types of fractures. These are all the different types of fractures that we're going to be looking at, and they each have a different definition actually. So you definitely need to study the Quizlet. All right, so So this is a closed fracture. There's no skin wound. So here's the definition up here at the top with the arrow. If it's a closed fracture, there's no skin wound. So you can see in the x-ray here that it's all enclosed. So this would be the skin here, skin and muscle. And so the bone is not sticking through the skin. So this is a closed fracture. A simple fracture, this is a fracture without rupture to ligaments or the skin, and a lot of times it's not even displaced. Okay, now this one is a little tiny bit displaced, but this would be easy. I'll show you a picture of a displaced fracture in just a few minutes. This is also called a hairline fracture, is a simple fracture. An open fracture. Now this is a fracture with a wound and the bone is protruding through the skin. So I'll post some videos that we normally watch in class to show you of some. It's not funny to show you some open fractures. They're just really difficult to watch. But an open fracture is when the bone is protruding through the skin. It's actually broken through the ligaments and muscle, and you're actually seeing the bone outside the skin. All right, so just a few other definitions that don't necessarily have a picture. A complex fracture is a separation of part of the bone, and that usually is going to require surgery. Complicated, this is when a fracture the bone is broken, and then that bone has injured some internal organ, like a broken rib puncturing the lung. Impacted fracture, this is when the bone is broken and it drives into another bone. So this is a lot of times what happens in facial fractures because there's so many bones in the face. In trauma or car accident, if there are facial bones fractured, they will usually be impacted into another bone. They've driven through another bone. All right, here is a displaced fracture. So here's your definition up here. The bone is not in alignment. That is horrific looking, very, very painful. Now this is not a compound fracture though, or because it's not open. All right, this right here is all just bruising. So the bone is not, this is not an open, this is not an open fracture because the skin is still holding the bone inside, but this is definitely displaced. So this is that's what it looks like on the outside. Sometimes this is what it could look like on the inside. Now this is displaced medially, so it's toward the inside of the arm. That fracture that we looked at before, this is a displacement laterally, that the bone is displaced, headed coming toward the side of the arm. All right, this is a green stick fracture. Again, here's your definition up here at the top. This is where the bone's partially bent and partially broken. So this gets its name. Think about a green stick. You know, a stick that is not turned brown yet. It's a new stick. It's, you know, you can bend it, but you can't really break it. So there's a partial break here, and it's partially bent also. This is a comminuted fracture, or this is the technical definition if someone says the bone has shattered. The bone's broken and splintered into pieces. Not sure if you can tell what part of the body this is, but this is actually the hip bone. And then, so this is the femur, the largest bone in the body. This would be terribly painful. But this most likely came from car accident, is where you would see this type of fracture. Doesn't look like it has broken through the skin, but the femur has been shattered. So this would be like someone had their feet up on the dash or something like that, and they had a car accident, and the femur drove in to the hip bone and shattered the femur. That's called comminuted, is the technical word for it. All right, this one is a Colles fracture. This is a break in the lower end of the radius. Okay, so the radius is the bone on the thumb side. So a break on the lower end of that is called a Colles fracture. Just has its own name. Of course, that's a very, very common fracture, is a radial fracture. Okay, the next type here is a compressed fracture. This is a break in one or more vertebrae caused by compressing or squeezing of the space between the vertebrae. This would be what is very, very common in osteoporosis, just as those bones are very just loose or more porous, that they end up being compressed together and breaking. So that's a compressed fracture. A lot of times this is one of the first signs of osteoporosis, which we'll get to in a few minutes. And this usually causes the hunchback, like people being hunched over, is from a series of compressed fractures. All right, this is a spiral fracture, and this is going to be your exit ticket. So if you or don't do the exit ticket, then I know you didn't watch the videos. The spiral fracture is a bone broken due to a twisting motion. This type of fracture, it can happen other ways, but this type of fracture is one that we see in an abuse situation, because this is where, this is the leg here, but this would be where either, a parent or someone had a hold. It doesn't have to be a parent. It also could be any type of abuse, domestic abuse between husband and wife or boyfriend and girlfriend or whatever. But most of the time in a spiral fracture, someone is holding the leg or the arm and the person is twisting, trying to get away from them. And the stronger person, if they're holding enough pressure as that or pulls that person back, it can cause a spiral fracture. So if you have a spiral fracture, you're probably going to see DHR, because this is normally caused by abuse. Doesn't have to be, but definitely is suspicious for abuse. So if you see this in a patient, you would definitely also want to look and make sure that, look for other signs of abuse, like neglect. How's their personal hygiene? Do they have any other bruises or abrasions or cuts or cigarette burns or anything like that? Other things that would make you think of an abuse situation. All right, so here's just another little animated picture again of the different types of fractures. The complex, this is going to be where it's out of alignment, usually has torn ligaments or something like that. Incomplete is also called green stick, partially bent, partially broken. Comminuted is where the bone has been shattered. Simple, it's also called a hairline fracture. Compound or open, this is where the bone has come through the skin. Colles is at the lower end of the radius and impacted. So this bone here, the top of the humerus, has driven into the bones around that socket, around the shoulder blade socket, and caused a fracture into those bones. All right, so what is our treatment for fractures? There's only one treatment for fractures. It has two subcategories, but reduction is what the treatment for fracture is called. And this is called putting the bone Reduction is putting the bone back in its proper place. So basically, bones heal themselves. They just have to be put back in the proper place so that they can heal. The younger you are, the quicker those bones heal and the better they heal. So a fourth grader that falls on the playground and has a broken arm is going to heal faster than a 92-year-old that falls in the ice today and has a broken arm. Going to heal much faster and much better. But bones do heal themselves. So our only goal as healthcare providers is to provide the treatment, which is reduction. There are two different types of reduction. The first one is a closed reduction. This is where you position the bone in the correct alignment, and then you apply a cast or a splint to hold it in that place until it heals. If those of you that have had a broken bone, if it was out of place, they probably did the closed reduction in the doctor's office. I've helped reduce lots of breaks, mostly my own children's, in a doctor's office. They may have given you some pain medicine, maybe not. If it was very, very out of alignment, they may have put you under anesthesia to do the reduction and then put the cast on. It just depends on how badly it was out of place. But if you have had a cast, if you've had a broken bone and had a cast and no surgery, you had a closed reduction. You could have had a closed reduction and had to go under anesthesia just because of the painfulness. But if you didn't have any type of surgical repair or any type of stitches or anything like that, then you had a closed reduction. An open reduction is surgical repair, but they actually have to open the skin. So this could involve pins, it could involve plates or other devices, rods, things like that. But they actually have to go in and put something in the bone or around the bone. If it's pins or plates, then you may have to go back to have that hardware removed, but that is an open reduction. All right, so we're going to look at curvatures of the spine, and I know several of you guys and girls want to go into nurse anesthesia or anesthesiology one day. This is going to be important for you to understand the curvature of the spines, and that because some people, a lot of patients do have a little bit of an abnormal curvature. All of you have probably been tested in school, if they still do this, scoliosis screening. This is the side-to-side or lateral curvature of the spine. If this is mild, we usually don't do anything. If it's severe, like this one, this is probably taking a couple of inches off this person's height. You can see their spine is displaced. They also have some organ displacement through here. So this person actually has had rods to straighten their spine. All right, the next one is kyphosis, or this is a hunchback or a rounded bowing of the back at the thoracic area. So at the chest area, remember thoracic means chest, so up around the chest area of the backbone, would be a hunchback or rounded bowing of the back. Obviously, this can be caused by bad posture. Can also be caused by osteoporosis if this person has some compression fractures through there. Most of us have a little bit of kyphosis because we are hunched over computers or hunched over our phones. So as you're watching this, sit up just a little bit straighter and work on your posture for a minute so that you don't have kyphosis. All right, the third one is lordosis. This is a sway back or an abnormal inward curvature of the lumbar regions. So this, pregnant women have a little bit of lordosis or sway back for just the portion of time when they are big and pregnant and have the abdomen much larger. This can also be caused by obesity. So childhood obesity can add to lordosis or sway back because during the formative years, if the child is obese and has a large abdomen that pulls their back out, they can end up with lordosis. All right. Okay, so that's the different fractures and abnormal curvatures of the spine. Now we're going to look at just a few more skeletal diseases and disorders arthritis, sprains, osteomyelitis, and osteoporosis. So osteoarthritis, this is the most common form of arthritis. We're going to look at arthritis first. So osteoarthritis, this one's the most common form. It is a chronic disease that is a result of aging. So pretty much everybody is going to end up with some amount of osteoarthritis. The symptoms are joint pain, stiffness, aching, limited range of motion, and you may see this abbreviated ROM, but so limited range of motion there is all those are the symptoms of osteoarthritis. There is no cure for this. However, the treatment is rest, apply heat and cold, aspirin or NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, okay? So a example of an NSAID would be ibuprofen, Aleve, Motrin, Advil, all of those. Motrin, Advil, and ibuprofen are all the same type drug. The Motrin and Advil are just brand names for ibuprofen, where Aleve is a different type of NSAID. Toradol, that's a prescription NSAID, but all of those, they're non-steroidal anti-inflammatories. So that's one of the treatments. Tylenol works. Tylenol helps. It's not an NSAID, but it can help with pain. Injections are steroids. That's another treatment for osteoarthritis, and then physical therapy. So here are some pictures of arthritis, the different types of arthritis. This is what the normal joint should look like. You've got the bone, then you've got cartilage, and then you have these nice fluid-filled sacs that are surrounding your bones, okay? The bursa is one of those. It's a fluid-filled sac. Then you've got the synovial sacs. This is the synovial fluid. All of this is just shock absorbers, okay? And so this would be this here is the joint capsule, okay? So all of this is surrounding a normal. All right, the second picture is of osteoarthritis, and this is why this is just the result of aging. You can see over time how that cartilage has worn down. You still have the very nice joint capsule. There's nothing wrong with the joint capsule here. Nothing wrong with the bursa, but just the cartilage has worn down, and so there's just not enough. There's not enough shock absorber there. So as that cartilage wears down, it puts pressure. There's the synovial fluid and the synovial membrane. There's just nothing to separate. So you've really got bone on bone, and so that's why that's painful. All right, rheumatoid arthritis is a different story. We're going to look at the definition of it in just a second. But this can happen at any age, has nothing to do with aging. It is just it's actually an autoimmune disease. And you can see that the joint capsule is swollen and inflamed. The synovial membrane is swollen and inflamed, and the bursa could even be swollen and inflamed. But this would be rheumatoid arthritis. So the symptoms are in just a second are going to be the same. They're just going to be much worse in rheumatoid arthritis, and the treatment is different. All right, so this is rheumatoid arthritis is a chronic systemic inflammatory disease affecting connective tissue and joints. So here you can see the inflamed membrane and the swollen joint. The cartilage is somewhat eroded and the joint space has become narrowed. So there is pain in the joint, stiffness, aching, and limited range of motion. The treatment is rest, pain relief meds, but steroids is another thing that we definitely use in rheumatoid arthritis. Sometimes these patients will be on long-term steroids. Anti-inflammatory meds, that would be the NSAIDs that we talked about with osteoarthritis. But the other treatment for this is surgery and joint replacement. Over time, people that have rheumatoid arthritis normally end up having to have joint replacement surgery to fix this. All right, so a sprain, most of you guys have probably had a sprain. The definition of a sprain is twisting action that tears the ligaments of a joint. So you may have heard before if you sprained an ankle or arm or something that a sprain can sometimes be worse than a break, and it can sometimes take longer to heal. This is a great animated picture of a sprain because you can see how that ligament is torn halfway through. You could actually have a complete torn ligament, but in this one it's just partially torn. So the symptoms are going to be pain, swelling, discoloration. You can see all this bruising here from a sprain. There's no way to tell if an ankle or a wrist or any extremity is broken or sprained without an x-ray. If I looked at this, if you showed me this, I would say you're going to have to go get that checked because there's no way for me to tell just looking at it whether it's broken or sprained. The treatment, if once we realize, okay, it's just a sprain, not a break, is rest, pain relief meds, elevation, immobilization, and ice. Those are your treatments for a sprain. Okay, osteoporosis. Some of you guys did your lifestyle disease project on osteoporosis, and most of you guys did such a great job on those. So you know a lot about it. But osteoporosis is increased porosity or softening of bones. So you can see in the pictures there that there's just the bone becomes more porous. This is a metabolic disorder caused by hormone deficiency. We talked about this in class with girls when we lose our estrogen, when we get older and go through menopause. That's when really osteoporosis really sets in for women. Also, lack of calcium and a sedentary lifestyle all add to osteoporosis. Not that men cannot get osteoporosis. Of course, they do. You've probably all seen men that were hunched over from osteoporosis and have had broken hips and things like that. It just usually hits men a little later than it hits women. All right, so the symptoms, a lot of the symptoms are easily broken bones. They will start having deterioration of their vertebral support and have those compression fractures. So our treatment here is making sure that we're getting adequate calcium, adequate vitamin D, increasing those weight-bearing exercises, and then the bone density test is the test we do to look for osteoporosis to see how bad it is. All right, I told you that I would show you a picture of a hip replacement. This is a titanium rod here that once osteoporosis has caused those hip fractures, it's not going to heal. A hip fracture is in someone who has osteoporosis. That hip can't heal. The bone is too diseased. So they have to put in a artificial hip joint. And so this is what that looks like. They actually, open up the skin, and literally, this sounds kind of awful, but the bone is actually removed from the hip socket. It's broken off. They have to get that broken, diseased bone out. They drill down into the femur and put in the titanium rod or stainless steel, and then attach it back to the hip socket. All right, osteomyelitis, this is infection in the bone, all right? So, and this is an inside look of what this looks like, but on the outside, they're going to have pain and swelling. So how are you going to know any difference from just a sprain or a break? Well, you might not to start with, but pain and swelling, then the person will develop chills and a fever, and then there will be some symptoms on the outside. I'll show you what that looks like. Treatment is these people are going to have IV antibiotics to stop bone destruction. What's really scary about osteomyelitis is that someone can get this from just like stumping their toe. They don't have to have any kind of really severe injury in order to get infection in the bone. Most of the time what happens is this could be someone who already has an infection. They could have MRSA. They could have some type of infection that's floating around their bloodstream, and they're not sick from it. There's not enough of it to be sick, but then they stump their toe or maybe they slide into second base and sprain their ankle or something like that, and that just becomes an opportune time for that bacteria to attack and start to replicate. So it will start to look like this on the outside. So they will actually start to have the pain. They'll have so much swelling and so much infection from the bone that it's actually coming through to the skin. Yet again, this takes an x-ray to diagnose, they have to see an orthopedic doctor in order to diagnose osteomyelitis. All right, so let's move on. We're going to quickly look at muscular diseases and disorders. There are 7 of these, and some of these you may have heard of, some of these you may have experienced yourself. All right, so fibromyalgia, if you have heard of this, it's become this is sort of a new diagnosis over the last few years. Actually, years ago, people, mostly women, just got diagnosed with hypochondria. And if you don't know what that is, then you can look it up. But it was just where they thought they were sick all the time. They couldn't have tests and can't figure out what's wrong with them. So, doctors really just sort of passed them off as, somebody who just thinks they're sick all the time, thinking it's a mental disorder. When now we know that a lot of women, and more in particular, men do have this, but it affects women more, have what's called fibromyalgia. And this is characterized by widespread musculoskeletal pain. So they just have pain, just widespread pain, and they usually will have fatigue, which means they're tired a lot, sleep issues, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain and spinal cord process painful and non-painful signals. So these people really are having pain, even though it just seems like their nerve endings maybe are more sensitive. We don't understand a lot about this disease, but these are the cardinal symptoms. And every time I look at this, I think, oh my gosh, I have it. Because I do have a lot of pain in my neck and upper back. But just because you have pain in your neck and upper back doesn't necessarily mean that you have fibromyalgia. But these are the cardinal tender points: the upper neck, the back, the elbows, and then the lower back here. Also, stiffness, fatigue, and non-restorative sleep would be an indication that a patient needs to get checked out for fibromyalgia. All right, muscular dystrophy. This is a group of genetic diseases that cause progressive muscle weakness and a loss of muscle mass. Muscular dystrophy is a terrible, debilitative diagnosis to receive. It is genetic, so if someone in your family has had it, it can be passed on to you or your offspring. One of the worst ones is what's called Duchenne's muscular dystrophy, progressive weakness and wasting away of muscles. The onset of this is usually when the child is 3 to 5 years old. So they've developed normally until they are 3 to 5 for the most part. They may have had some motor delays, like they may not have hit some of their landmarks like walking and crawling and all of those things. They may not have met some of those on time. They may just be clumsy and fall frequently, have difficulty climbing stairs, running, or riding a tricycle. But, kids are clumsy. Those of you that have babysat, you see kids fall down all the time and they just get back up. They will also have what's called Gower's sign, which is, you can see like a picture. They may sit like this when they're in a sitting position. They could have a waddling gait. By the time they're 12, so they're probably going to be diagnosed between 3 and 5 years old, and they're usually having trouble walking by age 12. And so then they, as it progresses, they have trouble breathing. and they can usually have a life-threatening infection like pneumonia that then leads to death. So most of the time, people with this severe type of, the worst type of muscular dystrophy, Duchenne's muscular dystrophy, usually die between the ages of 15 to 18 years old. So nursing considerations are what we're looking for to do as medical providers is just address the fatigue and the infrequent infections, help them be mobile for as long as possible and maintain their function as long as possible. And then also just make sure that their psychological well-being is being addressed on a regular basis. This would be a teenager that would be at a high risk for suicide. All right, myasthenia gravis. This is a neuromuscular disorder causing weakness in the skeletal muscles, and it occurs when communication between nerve cells and muscles become impaired. A lot of these, and we'll look at nervous system disorders next week, but a lot of these are, it's not necessarily the muscle, it's the nervous system and the muscular system. So there's a impairment here between the nerve cells and the muscles. This usually, it starts affecting the facial area first. So these people will have a droopy eyelid and a droopy mouth. They may end up having difficulty swallowing. They may have double vision and eventually have an unsteady walk. This can be treated. There's no cure, but there are treatment options for it. Okay, bursitis. Bursitis is inflammation or irritation of the bursa. You have bursa sacs around every joint, and it's just a shock absorber yet again. But when this little sac gets inflamed, it can be so painful. If you've never had bursitis, that's great. You will know when you have it. Because it causes a lot of inflammation and severe pain around the joint. It can even, that bursa can swell as much as in this horrible picture of this knee here. I had bursitis a couple of years ago when I was training for a 5K, and I just kept running even though I just thought that because I could do the elliptical for 30, 45 minutes that was the same as running. No, it is not. Running on the concrete is much harder on your joints than doing an elliptical or even running on a treadmill. So you can see here this little fluid filled sac just gets inflamed and very painful. Treatment is, well, we're going to get to the treatments of all these last few things in a second. All right, dislocation. This is an injury where a joint is forced out of normal position. You've probably had a finger or some type of joint dislocated before. The next couple of pictures are some pretty severe dislocations. Yeah, you can see here this is the shoulder joint is dislocated. And here's a dislocated finger. That looks very painful. Basically, all it has to do is be popped back into place. It can just be very painful to do so. All right, so the treatment for all of these things is the acronym RICE, okay? Rest, ice, elevation, and compression, okay? So as you can see, the guy there, he's on crutches. He's not doing weight bearing on that side. So he could have bursitis, he could have a sprain, he could have a fracture even and just it not be able to be weight bearing. But so rest for one thing. Elevation, keeping that elevated above the heart is the best, but at least keeping it somewhat elevated. Then ice, and not icing continuously. You usually want to ice it 20 minutes every couple of hours. And then compression, ACE bandage, that can certainly help keeping that compressed. And then that's our main treatment, but of course, pain relief medications, NSAID medications like Advil or ibuprofen, all of those are also. All right, so I was trying to keep this video to 30 minutes. I went 4 minutes over, but so this is for the portion on musculoskeletal disorders. Make sure you study your Quizlet.